Today, there's good news for people with inflammatory bowel disease or a poorly functioning J-pouch, cock pouch, or ileostomy. You owe it to yourself to learn more about the comfort, convenience, and confidence of appliance-free living.
If you or someone you love is suffering from severe inflammatory bowel disease or poorly functioning ileostomy, perhaps it's time to discover an appliance-free option. The Barnett Continent Intestinal Reservoir, or BCIR, at the Continent Ostomy Center at Palms of Pasadena Hospital. BCIR uses your body's own tissues to form an internal pouch, which is drained via a small opening low in the abdomen. With no external appliance, patients are free to enjoy nearly any kind of activity and wear most any clothing. The pouch is attached to the wall of the abdomen with a short segment of the intestine leading from the pouch to the stoma. Because there's no projecting spout or protruding stoma, the opening is simply covered with a small adhesive bandage. The BCIR stores waste internally, so you control disposal by deciding when and where to empty the pouch, usually 2 to 5 times a day, directly into a toilet using a small silicone catheter inserted into the stoma. The BCIR pouch has a collar at the top with a constricting action that increases as the tension within the pouch rises, enhancing continence. Candidates for the BCIR procedure include patients who have problems associated with the conventional or Bruch ileostomy, patients who have a failed continent pouch or cock pouch, failed ileal pouch anal anastomosis, known as IPAA, J-pouch, pull-through, or other similar procedures, individuals who have familial polyposis, FP, a case of medically unresponsive ulcerative colitis, or other conditions precluding their being candidates for the J-pouch, or those who elect not to have the J-pouch. Medical Director Dr. Ernest Renke has specialized in BCIR since 1994. Thanks to his team's unique expertise in a welcoming recovery environment, Palms of Pasadena Hospital attracts patients from all over the U.S. to sunny St. Petersburg, Florida, for this life-changing procedure.
With regards to why I'm doing BCIRs, I think it really is because of the interaction and long-term relationships that I'm able to have with the patients. And to me, that's a big paradigm shift for a surgeon. And typically as a surgeon, you take care of a patient, take their gallbladder out, you see them a time or two, and then they're on their way. And with the BCIR, we truly become family. And so it's not only us, it's our nursing staff, and that's what really makes the difference.
90% of patients surveyed about their quality of life said that they felt much or somewhat better since their BCIR operation. They enjoy the simple things like hiking, biking, playing with children, walking the dog, and enjoying favorite foods. They also report comfortable participation in strenuous sports like swimming, skiing, scuba diving, weightlifting, and zip lining. And they report enhanced intimate relationships, successful pregnancies, and more confidence to pursue their dreams. Here are a few of their stories.
The BCIR has changed my life in every way, shape, and form.
It gave me my life back.
It's given me back the greatest normalcy that I'll ever have.
Freedom, control, and complete confidence.
It helped put some self-esteem back in my life.
It's better than any other alternative that I know of.
It's given me the freedom, I guess, to be myself and to live my life the way I wanted to.
The care that I received at Palms of Pasadena Hospital was excellent.
The nurses are fabulous. They listen to you, take time with you.
All I can say is, for those that are contemplating some type of surgery like this, please read about it and talk to our surgeons, because it's one of the best type of surgeries that you could have for our situation.
The Continent Ostomy Center at Palms of Pasadena Hospital has developed a 6-step process to help you determine if BCIR is right for you. First, call 800-494-7246 to discuss your case with one of our clinical representatives. You'll be instructed about how to send your medical records for review by our team. Then talk to some BCIR patients and ask them about their experiences. The medical team will advise you about the results of your medical records review. Then a representative will help you determine your insurance benefits and send you your pre-admission package. BCIR brings the comfort, convenience, and confidence of appliance-free living to many kinds of patients. Contact us today to see if BCIR is right for you.
To learn more about BCIR at Palms of Pasadena Hospital, including many more patient testimonials, frequently asked questions, and upcoming information seminars, visit bcir.com or call 800-494-7246.